We're set. Good morning. Welcome. Thank you for joining us this morning. I am live this morning on Tuesday with, I'm going to call him Dr. Roy. Roy is going to talk to us about a very important topic today. If you have questions or comments, please put them in the comment section. I'll be looking for those, and Roy will answer those live on air for you. If you are listening to a playback, he won't be able to answer your questions, but feel free to dialogue with anybody else who's also putting questions and comments in the comment section. Dr. Reese, Roy, thank you for joining us today.
It's my great pleasure. Thank you.
You're welcome. Today's topic is a serious topic. It's how to identify whether your teen's behavior warrants professional mental health care and what to do if you've made that determination. And Roy's going to help us sort through this issue, give us some information on what to do, and also how to navigate the COVID mental health atmosphere. Because once you've made the assessment, there may be a waiting list. So what can you do at home? Roy, can you just tell us a little bit about yourself and your work?
Sure. So I am a pediatric clinical psychologist and have been practicing in one capacity or another for about 27 years now. I've been in Atlanta practicing initially part-time the early part of my career because I was an academician. And I do more in the full-time space right now. In addition to being a practicing psychologist, I'm also a professor in the Department of Psychiatry and Community Health and Preventive Medicine at Morehouse School of Medicine, where I've been for about 16 years. But perhaps as relevant as anything that I will share about my qualifications or lack thereof this morning is the fact that I have a 23-year-old and a 14-year-old. And so I come with this wearing two hats. One is the parent of parenting a teen and attempting to support them, but also as somebody who's professionally worked with many young people and their families. So like I said, it's a pleasure to be with you all. I so appreciate being able to talk to parents about their teens on this side of the equation versus on my literal or figurative couch. Thank you.
Thank you. Okay, let's jump right on in. What are concerning behaviors? How do we know if our teen has a concerning behavior?
Yeah. So concerning behavior or attitude is nebulous because concerning in my family may be different than concerning in yours. So what I like to do initially is just kind of set a little bit of a backdrop.
Okay.
Every parent or caregiver of an adolescent or a child should be paying attention to what's going on with their kids, generally anyway, but in particular now. Last 2 years we've been in a pandemic, and none of us, right, have ever experienced a pandemic or how it impacts uh, well-being, mobility, access, development, etc. And so all of this for most of us is a new experience. And in the research literature, we have these things called adverse childhood experiences. And that's when a child has been exposed to some traumatic event or events. But what everybody should understand is that our children, our young people have been exposed to an adverse childhood experience over the course of the last 2 years. We've seen graduations compromised. We have seen extracurriculars compromised. We have seen kids take a step back academically in terms of how they're performing. And we have seen kids become isolated. And the argument from a public health standpoint is out of necessity as we've tried to mitigate the spread of the virus. But that has had real implications for kids, psychological and academic well-being. So that's the backdrop that we're talking about, understanding our young people and supporting them over these last couple of years. And so then we start talking about, so what are the concerning behaviors? And I imagine that some of your listeners have heard some of this before. So, for example, when we see our kids behaving or managing themselves differently, there are three domains in which our young people typically perform or have access to. That's academic, so what's going on at school, what's going on at home, and what's going on in the community. And what I look for is what I call converging lines of evidence. Do I see something different happening across those different contexts. And if I do, that rings a red flag for me. It says, hey, what's happening here? And some of those things can look like the young person has become less interested in activities that they previously enjoyed, right? And there's no quick bounce back. So, having your team kind of have a one-off week, that's no big deal. But if we notice things over a couple of 3 weeks, then those are the kinds of things that we begin to pay attention to. They're not hanging with their peers as often as they used to. Again, we really want to pay attention to that because, as I think about my son and my daughter, their peer groups really were kind of the driving forces of their well-being, their social life, and to some extent their academic life too, because they would study together, etc. And so when I saw changes, or when you see changes in those kind of things, you also want to pay attention. So if you notice your child isolating him or herself, um, and it appears that they're isolating both at home but also at school, I tell parents very often, check in with schools, see if schools are noticing anything different, because it would not be unusual to see one thing at home, right, and to see something different occurring at school. And so if your kid has a school counselor or some other teacher with whom you have a relationship with, and that the kid has a close relationship with, you want to do a check-in, like, hey, you see anything different happening with my son or daughter lately? If so, what are, hey, the teacher or the other person will say, well, do you have a concern? I say, well, yeah, here are some of the things that I see going on at home. And then there can be a conversation about what's going on. So we want to pay attention to what's different, but we don't want to freak out about what's different, nor do we want to make an attribution about what different is about. I tell parents one of the things that they very often have to be willing to do is to be willing to acknowledge that they don't know what's going on. And so this is where we have those conversations like, hey, you seem like you're kind of out of it the last couple of weeks. Maybe I got that wrong, but is there something going on? Asking those questions. We have all kinds of sources of information at our disposal, and we have to use that. Again, recognizing that we sometimes are not the best source of information. We should pay attention to what we're observing, but we may not always, know what's best. I can't tell you how many cases I've seen where a younger brother or older sister said, hey, so and so's got blah, blah, blah happening. I don't know what's going on with them, but I'm worried. Those are the things that I pay the most attention to. So when a sibling comes and says something to a parent that they're concerned about something, or when a friend comes and says something that they're concerned about, those again are the kinds of things I pay attention to. Or when a teacher reaches out and say, hey, I've noticed that your son or your daughter just seems to not be as engaged, to kind of have fallen off, etc. And so we have these multiple data sources that we need to pay attention to. And oftentimes, if we pay attention to those data sources early enough in the process, one of the things that we will find is that we can triage and intervene before our child might need professional services. Because a lot of times it's like, hey, what's going on? Let's talk about it. But often, we ignore, sometimes, most times, I said that wrong. Most times because we don't know what to pay attention to. But sometimes those things that we should be paying attention to don't get the attention that they warrant. And that then they begin to escalate. And there's a further deterioration in the well-being, the adjustment of our child. So then that we're moving closer to, I've got to get professionals involved, because this thing has gone from here, where maybe we could talk about and come up with some common sense interventions, to over here, where, this feels out of my wheelhouse. I need to go talk to somebody, or I need to have my child talk to somebody. And one of the reasons, and then I'll pass the mic back, that we really want to get in front of this is because kids, by their very nature, are going to resist. Hey, I want you to go talk to somebody. I do really well with kids. Most of the kids I work with like me. We have great relationships. But if we go back to that first or second appointment, they're like, "No, I'm good. Ain't nothing wrong with me. I don't even know why I'm here." Like, so it's like it's them. I'm like, yeah, they got the problem. I'm good. Like, so if you can help them, we'll be good, and we just keep this thing moving. So that's why we want to, when we can, kind of create opportunities for adjustment, positive adjustment, before you get to somebody like me.
Thank you. So one of the things that I heard in that is How do you know that there's a concerning behavior? You said if something different is happening without a quick bounce back. So there's something
Mhm.
changed in their behavior or attitude, and it's over a prolonged period of time. Or if somebody else points it out, because we miss things as the adult caregivers. We've got a lot going on, and it's okay if we miss something. But if someone points it out, then pay attention to what they're saying, even if it doesn't seem right to you. Address it, and if it's not right, you can check that off the list then. So
You summarized that so well. Thank you.
thank you. That's why I'm here. um, so let's say we've identified something that's required professional attention. What do we do now? We've found
Yeah.
something, someone's pointed it out, or it's been a long time. What do we do?
So we're talking about teenagers, and so one of the things that happens is they have a greater sense of agency, and when I grew up, you think you've grown,
Mhm.
and in fact they do, right?
Yes.
And so one of the things that very often we have to start with is engaging our team.
Mhm.
Hey, here's something's happening. I don't know what it is. And again, I go back to my prior point. We don't have to be right. We just have to pay attention. And if in the process of paying attention something doesn't feel right, we're then compelled to act. And our first step should be talking to our child. Like, help me understand this. No, it's good. I'm whatever. And or sometimes they'll tell you, I noticed this, like, yeah, I've really been struggling with, whatever it is. And so depending on the communication relationship we have with our child,
Mhm.
we oftentimes can get important understanding from them directly.
Mhm.
Excuse me. But sometimes we can't. And so sometimes there are these other important others in our child's life who our child will talk to before perhaps they'll share with us. And we'll have grandma check in. We'll have Uncle Larry check in, or Uncle Leon, or Uncle Rudy. We'll have people with whom we know that our child may be more likely to share some things, because oftentimes kids are concerned about how their parents are going to react if something is happening. That's fine. Or they know that this other person, this teacher, this coach, Uncle so and so, fictive or otherwise, can share things, can relay things to a parent in a way that the parent is going to digest. So I know this person is coming to me. It must be something real, and that I really need to be quiet, listen for the purpose of understanding and not responding. So that becomes first thing. Like, hey, let's figure out how we do a check in with our kid. The thing I often tell, because you will initially get that pushback, I say, absorb it.
Mhm.
In fact, anticipate it, right? Um, uh, and then lean in. I'm concerned about you. Something is amiss. I don't pretend to know what it is or
Mhm.
what we should do, but I am committed to us figuring this out together. If you have solutions or thoughts about how we should proceed, I'm happy to hear those, but I'm not willing, or nor am I going to do nothing based upon what I am seeing.
Mhm.
And that really takes a lot of pressure off of our team to say, hey, my parent is saying there's something going on, that we'll figure it out together, and we'll figure out a path towards things being better. That creates relief and comfort. And so even if you as the parent are kind of freaking out that, hey, I don't really know what's going on,
Mhm.
um, we really first want to take some pressure off of our child. I
Mhm.
think then what the parent does is say, okay, is this something that we can attend to at home, or through their extracurriculars, or through the resources they have available to them at school, or through the resources we have available um, in the community? So you may go to a church that has a youth ministry that is doing kind of innovative things to kind of promote well-being in kids, or you may be in a community that's doing really cool things at the YMCA. There are a variety of resources that we may have access to, and so can those resources, again, as a first tier response, help our young people? Because if we go from, hey, there's something going on, I'm calling Dr. Reese, kid is like, huh, what?
Yeah.
Yeah. And so we want to be able to say we've stepwise taken this. Now certainly if we have a situation where there are concerns about physical safety or emotional safety, we want to sound a different kind of alarm. But
Mhm.
even then, the first stop will be to talk to your young person. And then what I tell parents very often is they want to talk to the people who have a different caregiving relationship with the child. So, what is their school counselor? What is their favorite teacher seeing or saying? Is there some mentor or some other person in their life who has a helping relationship and who the child trusts? Oftentimes we go back to the pediatrician. And so one of the things I really encourage here, and this becomes one of those kind of desperate kinds of challenges because many folks in under-resourced and poor communities, their child may not have a medical home. They may not have an existing relationship with a pediatrician, which is a challenge that we need to attend to. But where those do happen, I'll say, hey, make an appointment with the pediatrician, right? Oftentimes, when you take your child into the pediatrician, they have to complete screeners. Hey, what's been going on? How you been feeling? Have you felt or thought about X, Y, and Z in the last 30 days? Those kinds of things. And so, then in that interview, particularly if your child has a relationship with his or her pediatrician or their pediatrician, they can have conversations about, hey, so your mom or your dad or you filled out this survey and it suggests that you might be struggling with a little bit of sadness or isolation. Can we talk about that?
Mhm.
And that's important because that's a pre-existing relationship. When you come see me for the first time, you have to form, develop, and that takes time, a relationship with me. But there are those helping individuals with whom we have access to that have a good relationship with our child. We want to take advantage of those because oftentimes then the pediatrician can also say, you know what, this might be a little bit out of my wheelhouse, or I think we need to get some other people involved. I want to refer you to person Y, person X. That's somebody I've worked with a lot in the past. I really trust their work, and I really think that they can help you better. And actually, not only help you, help me, and help your parents, your family better understand what's going on and what
Mhm.
we should do here. So those are some of the kinds of things that parents should do. Kind of gather information,
Mhm.
um, check in with their kid, um, and then depending on the information. And the thing I tell parents is, if you don't know, ask.
Mhm.
There are so many helplines out there. Hey, this is going on with my kid. I don't know what to do. And oftentimes they can say, hey, here's some of the things that we can do that become that low hanging fruit. Let's
Mhm.
do those things. And other times they can say, you know what? We got to get some other people involved here now. What I want you to do is I want you to walk into an emergency department, or I want you to make an immediate appointment with your pediatrician, etc. And so, we have behavioral health experts like me and other folks out there for a reason. So don't be afraid to utilize us in terms of asking those important level setting questions that can give you guidance about what you should do next.
So you mentioned helplines. Other than your pediatrician and people at school, what are some of the helplines? Or do you have any off the top of your head that we can put in our comment section for our audience?
Sure. So the American Academy, and I'm cheating. I'm looking at my notes.
No, please
Um,
do.
yeah, the American Academy of Child and Adolescent Psychiatry has a website that has a number of wonderful resources on it called adolescenthealth.org. And I'll send this to you as well. So it's adolescenthealth.org.
Mhm.
And again, those are behavioral health resources um, that organization makes available to young people. In addition, SAMHSA has a national, which is the Substance Abuse and Mental Health um, Agency of the National Institute or of the Department of Health and Human Services. They have a national helpline, and that number is 1-800-662-4357. So again, that's 1-800-662-4357.
Okay.
Beyond those resources, a couple of other ones. Um, is the NIH. So at nimh.nih.gov, they have what they refer to as digital shareable resources on child and adolescent mental health. And so those are national resources. And then there's also NAMI, the National Alliance for Mental Illness.
Mhm.
And there's a web source. They have a link on kids, teens, and young adults with regard to mental health. Those are national resources, but in your communities. So if you put in behavioral health, mental health resources for adolescents in Atlanta, where I'm at. A
Mhm.
bunch of things will come up. If you do that in whatever locale, you put in your city, you put in your county, you put in your state, there will also be those hotlines. There'll be hospitals, for example. In Georgia, we have CHOA that has hotlines where if you pick up, and that's a Children's Hospital of Atlanta. Yeah, Children's Hospital. Had to think that through.
I was doing the same thing.
Yeah. So if you call CHOA's hotline, they can help you triage with a nurse on the phone and direct you both within their organization, but also direct you to local resources. And that's really one of the things I want to drive home here. You're not in here. You're not in this by yourself. And as scary and as overwhelming as your kid struggling either with a physical health or mental health thing, you're not here by yourself. And oftentimes when we see some of the physical health kind of challenges in our kids, there's actually a behavioral health component to it because those two things intersect to help us understand wellness. So those are some of the hotlines that I would direct listeners to.
Can you repeat the last one that you put, behavioral health, adolescents, and then your city or county? Can you repeat that one again, please?
Sure.
We'll put them in the
So if
comments.
you do, uh, so if you do a Google search for mental health resources for children and adolescents, and then put your city,
Okay.
that's one search.
Okay.
Behavioral and mental health resources for children and adolescents, put your county, that's another search. And then do the same thing for your state. That what will happen is that all kinds of resources will come up. Um, and here's the thing about some of those national resources. So when I think about the American Academy of Child and Adolescent Psychiatry, you can actually go there and do a localized search for what's going on in your wherever you live. For the SAMHSA resource, they will help you identify resources. And for those folks who have insurance, here's the important thing: almost all insurance providers now have case management units, offices, kind of within the services they provide to their consumers. If you call and say, "Hey, this is going on with my kid. I need help identifying resources," they'll do everything from help you identify a provider that's in your network that's accepting new patients to help you identify local resources. Because one of the things that we know in a number of these instances is that families are running into wait lists. You call provider X, and that person has a 1 month, 2 month, 3 month, 4 month wait list, and you say, I don't got 3 months, right? But when you call your insurance company or some of these other resources, they can help you identify other interventions and other support services for your child that might be of helpful. Because, like, for example, in the state of Georgia, we have a significant shortage, paucity of behavioral health and mental health providers. And almost anybody I know whose work I think is a value add has a wait list right now. And so, with that in mind, there are a lot of interventions and supports that may not rise to the level of what somebody like I might do,
Mhm.
but that can provide some relief while we're waiting on a wait list. And what I tell parents is that they think, or they've gotten guidance from, for example, the pediatrician or the school counselor, that their child might really need that level of service, they should get on a wait list or wait list as soon as possible, but
Mhm.
that should not be a stopping point. They should say, "Hey, let me go back to these youth serving organizations that my kid might be connected to. Let me go back to the school. Because pediatricians are really struggling with this right now. How
Yeah.
do they support their patients?" And so many of them have in-office resources. So you see a number of pediatric practices now that have social workers or counselors within their office to kind of help triage kids. All pediatricians have relationships with counselors, psychologists, psychiatrists with whom they refer to, or they know somebody who has those relationships. And so those are the resources that we want to access. We don't have to figure it out by ourselves when we have these types of individuals available to us.
I was going to ask you about wait lists, so thank you for saying that. I want to remind people we're almost at the end of our time, so if you have any questions for Dr. Roy, please put them in the comment section so we can get to them. And also, when this is over, feel free to scroll the comment section because all of the resources he mentioned are already in the comment section, so all you have to do is click the links to access them. So if we find a wait list and we go to and we get on the wait list and we're utilizing youth services in our community or a social worker, and it doesn't seem to be enough. One, what are realistic expectations? I know it varies depending on the child and the situation, but what do we do if it's clear that that's not enough?
Okay. So that's when we have a powwow, right? So again, I'm encouraging parents to not feel like they have to figure this out for themselves, particularly if you have access to a behavioral health provider. And so it's what we can do or what we have access to is not enough. None of us are trying to see our kids suffer unnecessarily. None of us are trying to see us lose our kids. All of us would be naive if we said if we do nothing that neither of those things could happen. We have enough data points to know that that's not true. And so this is where we sit with the pediatrician and or his PA or her PA and say, hey, we got to figure this out. This is where we call the insurance company and say, hey, we've got to figure this out. When we have crises that are acute and require immediate action, the hardest thing that I do in my work is to hospitalize a child. It is unequivocally because I'm saying I don't feel comfortable that it's okay to let you leave. I'm worried about your safety. And so I'm now going to make choices for you. And I'm okay with a kid being upset with me if that means that kid sees tomorrow. And so when we have those kinds of concerns about what's happening with our young people, we walk into an emergency department. We have those kind of concerns. Most states, I know they do here in Georgia, have mobile crisis units that will come to you to help evaluate the situation and make a determination about, hey, what do we need to do here to keep this kid safe and to keep this kid all right? And frankly, increasingly, because sometimes we see aggressive behavior. I'm not a fan of ever unnecessarily including law enforcement. But sometimes when law enforcement gets involved, if you say, I have a mental health situation with my child, I'm asking that you dispatch an officer who has a background or training who's gone through, there's training that law enforcement is going through now to help increase their awareness and their skill in de-escalating and supporting young people. Because I think that we can't fix when the problem is spiraled out of control. And so I think that when we see things happening, that we have to act. And if we can't wait, there are these other options. But I think almost always it is the rare situation that we're talking about a kid who has to be hospitalized. It's the rare situation where if we pay attention to what's going on in front of us, that there's a kid who might attempt to hurt themselves if we act. Now, one of the other things I tell parents, there's a course called Mental Health First Aid. I think it should be required training for all parents, all teachers, all coaches, etc. Because part of what it does is it gives you the information. So we're talking today, but the difference between talking and you having worksheets and PowerPoints that tell you, hey, here are the things that you can do if you notice this or you notice that. And so again, that's mental health first aid. They offer them all across the country. Many youth serving organizations have mental first aid staff there who you can call and you say, hey, can I talk to somebody who's got some training in mental health first aid? And oftentimes they can connect you with such an individual.
That's really valuable. I know that this is a sensitive topic and not necessarily one that people want to talk about in public, and this is a public forum. So please use the resources in the comment section in the privacy of your own home or car or wherever, so that you can access the information and personnel that you may need. And as Dr. Roy said, you are not alone. And if you run into a wait list or a similar situation, keep calling. I receive lots of calls from parents with teens who need professional mental health care, or their parents think they may need it. And the ones who are successful at accessing it are the ones who just keep calling and emailing. and really just making it a schedule, scheduling it into their day. They just, you know, every day at 10 o'clock, that's what I'm going to do. I'm going to make 3 calls until something opens up. And usually it opens up during the call. Like, oh, I'm so glad you called. We just happen to have a spot. So you have to keep doing that. And I know it's hard. And I know that when you're having these conversations with your teen or their favorite teacher or somebody else, that inside the anxiety is building within you. It's okay to feel that. You're keeping calm on the outside for your teen. But then take the break for yourself, because I know that this is very important to you and the anxiety is building for you, but you can do it. You can do this for yourself and you can do it for your teen. The most important thing I learned today was the way to ascertain if a behavior needs attention, professional attention, is not if your child has changed their attitude or their pattern temporarily, because that's going to happen. They're growing, they're having experiences. It's whether it's over a prolonged period of time. And that prolonged period of time is something that only you can define in your household. Some teens bounce back quicker than others, whether it's a heartbreak situation that has triggered something else. So you really have to get to know your teen and then talk to them and see how they feel about it. Because they may be like, yeah, this is difficult, but I'm working through it. Or they may be like, no, I need some more people to talk to. Roy, if parents heard only one thing during this very, very valuable conversation, what is the one thing that you want them to take away?
Well, I think you stole my thunder. And I don't really appreciate that, just so you know. But it would be one, you're not in this alone, and asking for help and repeatedly asking for help will get you a response somewhere. It hurts me that there's a element of truth in what you said about we have to keep calling. I recall a parent saying to my front office, I just appreciate that you called back. So that's a real thing, but it's not an insurmountable thing. But the other part of that story is that this parent had continued to call. And so if following your advice, keep calling, keep checking in, that's important. The other thing that you said, we can't take care of our babies if we don't take care of ourselves. And so the permission you gave parents to kind of take a time out, catch their breath, reset, that means you got to put your hands on your knees for a second to catch that breath is important. And our kids are oftentimes so often paying attention to what we do. And so if we normalize that we might be struggling and that we might need help, it gives them permission to also do that. Like, you know what, I'm trying to figure this thing out, or we're having a tough day. And so parents have got to take care of themselves. And the thing I say to parents all the time is I've never met a perfect parent in my entire life. And then I say I'm the president of the Not Perfect Parent Club. And I say raising healthy and successful young people is a team sport. None of us do that well by ourselves. And so we have to allow those members of our community who are willing to help and have the skills and expertise to help to do just that.
That's perfect. Remember to let your child at any age see you when you need to take a break. And that's how you're modeling the behavior. And you can even tell them. We've all had teens tell us some difficult things. And my relationship got better with mine when I was able to say, okay, that's a tough one for me. I'm going to need a moment to adjust. There's no value judgment. Give me that moment. And then we're going to continue this conversation. And the respect level rose, theirs for me and mine for them, when we both were vulnerable and admitted that, okay, this is something difficult, but we're going to do this together. So feel free to do that with your teens.
Absolutely.
Roy, thank you so much. This is the beginning of a valuable conversation, but we wanted to put it out there because we know a lot of parents are wondering, what is it I'm supposed to do? A lot of them are encountering this wait list. Tomorrow's conversation will be a little more lighthearted because tomorrow is coffee with Jen and Sharon, both moms, and they sit back, have coffee in the morning after the whole morning rush thing is done, and dish about something related to parenting. Every Wednesday, you can catch them same time, 10:30 a.m. on our Facebook page, YouTube channel, or Twitter account. That's Your Teen for Parents. Thank you very much for joining us. Have a great day.
Thank you.